Hi, my name is Don, and I just wanted to give an update to the video that I posted last week. If you remember, I had back surgery last week on the L5-S1. It was a microdiscectomy for a herniated disc, and on that video I kind of talked about my journey leading up to the surgery and my expectations of the day and what happened on the day of the surgery, and hopefully those of you who are considering having this surgery, you'll find that helpful. But it's been about a week and I wanted to give an update. So overall, it's been really great. I'm really glad that I did the surgery. I haven't had any more of that awful sciatica pain. Before I had the sciatica pain down my right leg all the way down to my foot, and that's pretty much gone. How have I felt since then? Other than the numbness, I felt pretty good. I have had a lot of numbness in my right foot. If you remember from the first video, when I came home, I had little spots of numbness on the bottom of my foot, and then as the day progressed, the entire sole of my foot went numb, and now a week later, everything from about mid-calf all the way down to my foot is completely numb, and it's kind of disconcerting. It's a little bit uncomfortable. If to give you an idea of what that feels like, it feels like non-stop, constant. It feels like I have on a shoe that's about 2 sizes too small, and all of my toes are jammed up in that shoe, and my foot has fallen asleep. So I keep wanting to shake my foot. I keep feeling like I want to reach down and remove the shoe, but there's no shoe on there. Of course, that's just the sensation that you have from the surgery. The doctor basically said that when they did the surgery, they had to go in and move that nerve out of the way. He said that a nerve is typically the size of like a pencil lead, but my nerve had swelled to the size of a thumb, and he put everything back in there, and you kind of have to see what happens, and in my case, my foot went numb. So what else? I think the thing that really surprised me most about the surgery is when I removed the bandages. So I tried to leave the bandages on there as long as I could, even though the doctor said I could remove them that same day. My wife was a little bit freaked out about my taking my bandages off, so I left them on there for 2 nights. The bandages are like, about a ½ inch thick of gauze, and so you're trying to sleep on that, and the wound is fresh, and so that was uncomfortable. So I woke her up in the middle of the night on the second night, said, please take these bandages off of me. So we removed the bandages, and the thing that surprised me most was that there's a hole in my back about the size of a dime, and it's big enough to stick your finger into. It basically looks like I have a belly button slightly above my pant line. And I'll admit that I'm vain, so didn't think that I'd be able to live with a navel on my back. So the first thing that I did was I called the doctor up on Monday. I had the surgery on Friday. I called my doctor up on Monday. Actually called the doctor up after hours on Sunday and asked him what we're going to do about this navel. But I made an appointment with him on that Monday, and he reassured me that it would go away after 6 months or so. It just when he did the surgery, your arms are up like this, and you'll notice that my shirt goes up. Well, your skin goes up too. So he does the operation, your arms come back down, and the hole, what's left, it resembles a belly button because of that. So I just need some time to fill in. Fingers crossed that'll happen, because I want to do yoga eventually, and I'm not going to be able to do yoga with a hole in my back. I wanted to give you some advice about how to sleep. My physical therapist had told me going into the surgery that the best way to sleep, because you can't bend and you can't twist. And leading up to the surgery, I had purchased a brand new mattress. I wanted to be able to come home and sleep on a nice soft mattress. And unfortunately, the mattress is a lot higher than what I expected. So what I did was I put a step stool in front of my bed. I step up on the mattress, and then you lift both of your knees up, fall off to the side onto the bed, and then let your knees down, and then roll over onto your back. And so that's the best way, and then reverse that getting up out of bed. And so because you can't twist, and so that became kind of a challenge for me getting in and out of the bed, because I'm in a much softer bed. I'm kind of like down in the bed trying to roll over and get in and out. But So if you're considering getting a bed, you might want to kind of experiment with that after you get the surgery, because you're going to have enough challenges with the surgery itself. Trying to adjust with the new mattress. So something to think about. The first week you're going to need a lot of help. So don't be afraid to ask family or someone to be there to help you. I've got a teenager in the house who grumbles every time you ask him to do anything. So he's been doing a whole lot of grumbling this week because I need help with things like, can you get down in the closet and hand me my shoes? Can you get my socks out of the bottom drawer for me? I've gotten pretty good about actually putting my socks on. I can't bend down and put my socks on, but I had been doing a lot of yoga leading up to the surgery. Actually, the night before I had the surgery, I did like an hour of yoga. So I can pretty much stand on one foot and twist my foot up to my, up to my waist where I can then put my socks on. So that's a good idea to be, to try to be in shape before you go into the surgery. The better shape that you're in, I think that the better shape that you're in going into the surgery, I think that the easier the outcome is going to be following the surgery. So that's it. It's been a week. I will post another video maybe in another couple of weeks just to kind of give an idea. Hopefully I'll be able to say that I'm getting some sense back into my feet, and hopefully the belly button will be kind of starting to fill in. But at about that time I'll be getting ready to begin physical therapy, and so I'm going to be really excited to get back to moving again because I'm just so stiff and everything's kind of sore and I'm ready to do something. So I'll post something in about 2 weeks. Thanks.